Next is Clostridium tetani. You have probably heard of this. Tetanus. These bacteria are motile. They form round terminal spores. So if you do a spore stain and you look at them under the microscope, you see they almost look like tennis rackets. These are a little bit more difficult to grow. They are extremely sensitive to oxygen, so any oxygen exposure can kill them. We can see kind of three, manifestations of disease. Generalized tetanus. So tetanus is like muscle spasms. So you can have it occur all over the body. You can have it be localized where the primary infection is, or you can have infection of neonates, and this is primarily involving the umbilical stump. The bacterium produces two toxins, tetanolysin, which is a hemolysin. It's really hard to determine the clinical significance of this toxin because it's, one, inhibited by oxygen, and two, it's inhibited by cholesterol, which our cells are full of cholesterol. So it may not be a toxin that actually is really active in the human body. The one we worry about is tetanospasmin. It is a neurotoxin. This toxin is produced during the stationary phase of bacterial growth, or bacterial stationary phase, which is technically not growth, but okay. And it can be released when the cell lyses. So it's not one that they secrete, it's as the cells die and lyse, they will release the toxin. It is an AB toxin. The binding domain will bind sialic acid and glycoproteins on nervous cells. And what it does, its mechanism of action, is that it cleaves the proteins that are responsible for the release of inhibitory neurotransmitters. So whenever we have a nerve impulse, there are neurotransmitters that can cause excitation of the next neuron, so you get whatever effect it is you need. And then to end that, you'll have inhibitory neurotransmitters that will end the transmission of the signal. When you can't release those inhibitory neurotransmitters, you get unregulated excitation of the next neuron. And in the muscles, that leads to spastic paralysis. Basically, the muscles are constantly contracting. And the reason it's called paralysis is because you no longer have control of those muscles. They are contracting, you are moving, but you are not controlling that movement. So again, it's a spastic type of paralysis. The tetanospasmin basically gets right in here and blocks the release of the inhibitory neurotransmitter. So only the excitatory neurotransmitters are being released, and you have that continuous stimulation. This bacterium is ubiquitous in the soil. It can sometimes colonize the GI tract. It's not super common, but again, it can. Spores will survive in nature for a very long time. And really the incubation period depends on how distant the wound is from the central nervous system. So with generalized tetanus, you'll see lockjaw, so you can no longer control opening and closing your mouth, back spasms, drooling. So these are two patients who have tetanus. This patient, they call it like a sardonic grin. He can't control his face, and so it's constantly like all the muscles in the face are contracting. And then this patient has, you can see the back spasms. He can't control his back. So if it gets into that central nervous system, if it gets near the brain, you have a much poorer prognosis. Again, neonates can be infected through the umbilical stump. So in some cultures, the practice was to seal off the umbilical stump with dung, and that could introduce spores. And so if the umbilical stump gets infected and the neonate gets tetanus, the mortality rate is very high, greater than 90%. So here's a history of a patient with tetanus, an 86-year-old man. Saw a physician for care of a splinter wound in his right hand acquired 3 days earlier while gardening. He was not treated with either a tetanus toxoid vaccine or tetanus immunoglobulin. And when we talk about treatment over here, we'll talk more about that. 7 days later, he developed a sore throat, and after an additional 3 days, he presented to the hospital with difficulty talking, swallowing, and breathing, with chest pain and disorientation. Admitted to the hospital with diagnosis of a stroke. Those are very classic stroke symptoms as well. On his 4th hospital day, he had developed neck rigidity and respiratory failure, requiring a tracheostomy and mechanical ventilation. So he can no longer control his diaphragm. He was transferred to the ICU, where the clinical diagnosis of tetanus was made. Despite treatment with tetanus toxoid and immunoglobulin, the patient died 1 month after admission. This case illustrates that Clostridium tetani is ubiquitous in soil and can contaminate relatively minor wounds. It also illustrates the unrelenting progression of neurologic disease in untreated patients. One of the challenges is that patients are not able to get the toxin off the neurons. Once the toxin has bound to the neurons, it kind of stays there for a long time. So it's not a transient binding. It's a very, very permanent binding. Diagnosis is generally based on symptoms. Microscopy and culture are often not successful. You don't need high levels of the bacterium in order to cause the disease. You can perform an antitoxin neutralization test in mice. So you would take a sample from the patient, mix it with tetanus antiserum, and inject that into the mouse. If the mouse develops no symptoms, it worked. If you take just the sample from the patient and put it in a mouse, and the mouse gets tetanus, then you know the patient has tetanus. Treatment would be debridement of the wound to hopefully get rid of the microorganism, penicillin and metronidazole to again clear the infection. But the problem is, as we see with this patient, there was so much toxin already in the body that he couldn't overcome it. So rapid diagnostics is much preferred. Passive and active vaccination were both described in this case study. The active vaccination is, of course, our Tdap or DTaP. It's the T part of it. The T is tetanus. And again, just like with diphtheria, you are not being vaccinated against the bacterium. You are being vaccinated against the toxin. Passive vaccination is using preformed antibodies against tetanus toxin that are given to a patient who may have known exposure or more progressed disease. And those antibodies are usually isolated from horses. Immunity to this infection, or to the toxin, I should say, can wane. So it is recommended that you get your Tdap or DTaP vaccination every 10 years, or if you do get a wound. Finally, our last Clostridium species is Clostridium botulinum. This is also one that's a little bit difficult to culture. It is fastidious, it is spore forming, and of course anaerobic. It can produce 7 different toxins, A through G. 4 of them, for sure, are known to cause disease, and they cause relatively similar symptoms. Botulism can be foodborne. So if you ate something contaminated with the spores, you'll have blurred vision, dry mouth, because the bacterium can colonize in the mouth and produce the toxin, constipation, abdominal pain. Eventually in this case, you get flaccid paralysis. So flaccid paralysis means you cannot move your muscles because they don't contract at all. Infant botulism, generally nonspecific symptoms, constipation, weak cry, failure to thrive, that progresses to flaccid paralysis. Wound botulism, similar to foodborne disease, although the incubation period is longer with fewer GI symptoms. Inhalation botulism, rapid onset of symptoms and high mortality from inhalation exposure. And the high mortality is going to be because of pulmonary failure. Your diaphragm stops working. It is also an AB toxin. It binds to sialic acid receptors and glycoprotein. So it binds to the same type of cells using the same type of receptors. However, the mechanism of action is slightly different. With the tetanospasmin, we can't release the inhibitory neurotransmitters. With botulinum toxin, we cannot release acetylcholine. And acetylcholine is necessary to stimulate the muscles. So the toxin does block neurotransmission and leads to the flaccid paralysis, no muscle contraction. It is a rare cause of infection, but can be found in the soil as well. Foodborne botulism is typically associated with home canning. It can be sometimes associated with commercial canning. If you ever go to a grocery store and see a bulging can, do not buy the bulging can, because that means the bacteria are in there and they're producing gas, which is causing the can to bulge. You may also know, like if you buy anything in a glass jar, like jams or jellies, when you open the lid for the first time, the lid has a little pop. It has a little button that pops up. If you have just bought that at the store, you have not opened it, and the button is popped, do not eat it. The button means there's gas in there. So with foodborne botulism, weakness and dizziness 1 to 3 days after consumption, the bacteria have to have time to colonize and produce the toxin. All the symptoms we talked about. Death comes from respiratory paralysis. For patients who seek treatment, recovery can take months to years. Remember, this toxin binds pretty tightly, so it can take a long time to get over it. So here's a foodborne associated with commercial carrot juice. 3 patients went to a hospital in Georgia with cranial nerve palsies and progressive descending flaccid paralysis resulting in respiratory failure. They had all shared meals on the previous day. Because botulism was suspected, there's not much that causes that type of flaccid paralysis. The patients were treated with botulinum antitoxin. There was no progression of the symptoms, but they did remain hospitalized and on ventilators. So again, it takes time to have either new nerve endings form or to have the toxin eventually come off the nerve endings. An investigation determined that they had consumed contaminated carrot juice produced by a commercial vendor. Botulinum toxin type A was detected in the serum and stool of all 3 patients and in the leftover carrot juice. An additional patient in Florida was also hospitalized with respiratory failure and descending paralysis after drinking carrot juice sold in Florida. Because carrot juice has a low acid content, it's pretty neutral pH, 6. Clostridium botulinum spores can germinate and produce toxin if contaminated juice is left at room temp. So on the right-hand side, we have infant botulism. It can be associated with honey or milk powder, like formula. So that's why, it's very, very strict, the formula production, and why it is recommended to not give honey to infants under the age of 1. So for infants, the stomach pH is usually not as low as in adults. So they have a hard time, if the bacteria are viable, they would have a hard time breaking those down. If there are spores, infants tend to just have a lower GI tract movement than adults do. So again, that peristalsis is a little bit slower, which can give the bacteria time to colonize the gut. Again, you have those nonspecific initial symptoms, but it does have a relatively low mortality. And some of that is likely because parents are paranoid. I mean, I don't blame them. If your kid doesn't poop, you're probably calling the pediatrician within like a day or 2. So it's just really important, if you do have an infant, to keep an eye on them, and of course, avoid honey until they're a little bit older. So I'll read the case about infant botulism first, and then we'll talk about wound and inhalation. 4 children with infant botulism were reported to the CDC. Here's one of them. A 10-week-old infant with a history of constipation in the first month of life was admitted to the hospital after having difficulty in sucking and swallowing for 2 days. The infant was irritable. They hadn't eaten in 2 days, and they couldn't poop, so they're going to be irritable. Loss of facial expression, generalized muscle weakness, and constipation. Mechanical ventilation was required for 10 days because of respiratory failure. Diagnosis of infant botulism was established 29 days after onset of symptoms through detection of Clostridium botulinum producing toxin type B in the stool. The patient was treated with botulism immune globulin intravenous and discharged fully recovered after 20 days. In contrast with foodborne botulism, diagnosis of infant botulism can be made by detecting the organism in the baby's stool. They don't have a functioning microbiome yet. They don't have that rapid peristalsis like we do. So the bacteria can get to higher numbers and can be detected in the stool. Okay, so wound botulism, the toxin produced in contaminated wounds. Symptoms can be similar to foodborne, longer incubation period, fewer GI symptoms. This one is pretty rare. You'd have to get basically a wound infected with soil that would get this bacterium in there. Inhalation botulism is also very rare, but the idea is we talk about it because it's a potential bioweapon. If the toxin can be aerosolized, there would be a rapid onset of symptoms with high mortality. So inhalation botulism, again, super, super rare in normal contexts. Again, we would think of it more as a bioweapon. The activity of the toxin is usually how we confirm diagnosis. The isolation of the organism can be done from infant feces or serum or from wounds. Heating the specimen will kill non-spore formers to allow the isolation of Clostridium botulinum. There's a lot of bacteria in the stool. That's kind of the idea we're getting at here. And so if you want to isolate Clostridium, if you heat up the sample, that induces Clostridium to form a spore. So everything else should die, but Clostridium will still survive. You can do that same antitoxin assay in mice, and then you can treat with ventilation, gastric lavage, metronidazole or penicillin, and antitoxin. Prevention is through destroying the spores, proper food preparation and storage, and no honey consumption by infants. You've probably heard of Botox, the cosmetic treatment. So Botox is botulinum toxin that's injected into the skin. And the idea is that it causes localized paralysis, which is why people who have Botox, their faces look all weird, especially if they get it done too much. But it's supposed to help reduce wrinkles because wrinkles can be caused by the facial muscle activity. So if you can't move your facial muscles, you don't get wrinkles. And you also look like a wax statue. So you have to be very, very judicious with your use of Botox if that's what you choose to do. And then this was a headline out of Sacramento a few years ago. 1 dead, 9 hospitalized with botulism after eating nacho cheese sauce. So they got gas station nachos. And man, there's definitely a moment where sometimes you just want gas station nachos. But that's what caused botulism. So those are the Clostridium.